Let's now focus on the day's news, and we begin with the coronavirus daily update by the ministry, where on Tuesday we recorded the highest single-day spike in COVID-19 infections after 497 coronavirus cases were confirmed. Health Chief Administrative Secretary Dr. Mwangangi says with the numbers set to rise even further, Kenyans must take individual responsibility. The ministry further cautioning against stigmatizing those who have contracted the disease. That story by Nancy Okware starts off our coverage tonight on Channel 1 News Hour.
The country is slowly sliding into the red zone, with more coronavirus cases being recorded, despite ongoing efforts aimed at flattening the infection curve. On Tuesday, 497 coronavirus cases were recorded in a single day, just 3 shy of the 500 mark, with the ministry warning that the situation is set to get worse.
These figures will keep rising, something that should worry each and every one of us.
Nairobi County is still an area of concern after it recorded more than half of the new infections, standing at 292. The hotspots within the capital include Westlands, which had 39 new cases, Langata 35, Dagoretti North 34, Starehe 32, while Embakasi East had 30 new cases.
And in the last 3 days alone, Nairobi has registered 518 cases. And this indeed is a worrying trend, and something must be done. It is important that the residents of Nairobi are alert.
Kiambu County recorded 62 cases, Kajiado 51, Machakos 30, while Mombasa had 28 cases. Within that period, 71 more patients were discharged, with the number of fatalities rising by 5.
Total cumulative cases of COVID-19 who have passed through the ICU is 199. Out of this, we have had 90 discharges and 73 deaths. As of today, there are 36 people in ICUs throughout the Republic.
New evidence is emerging from across the world that this disease is actually a systemic disease, a disease that has effects on your heart, a disease that has effects on your kidneys, a disease that has effects when it comes to the clotting of your blood and the coagulation of your blood.
So far, 450 healthcare workers have been infected, with 414 having no any underlying medical conditions.
Only 16 had hypertension, 6 of them had asthma, 3 people reported diabetes, 5 are HIV positive, 1 had hypothyroidism, 1 with cardiomyopathy, and 4 with other cases.
Meanwhile, the ministry is appealing to Kenyans to desist from stigmatizing COVID-19 patients and those who have already recovered.
This is something that does not add value to this fight of COVID-19 and ends up stigmatizing the situation and making it even harder for us to be able to maintain our containment measures, for us to be able to work together, adopting a whole of society approach.
Nancy Okware, Channel 1 News.